Chairwoman Fargo, Chairman Sanchez, members of the committee, thank you for holding this important hearing today. It's both an honor and privilege to have an opportunity to address the issue of health disparities. I'm here specifically to support the pending legislation to establish a permanent statewide disparities program, Senate Bill 811, and to share a little bit of my own experiences as an administrator. My name is Dr. Roderick King. I'm a pediatrician, faculty at Harvard Medical School, and at the Mass General Disparities Solution Center. And I've worked as a provider, researcher, administrator in efforts to reduce disparities. And I believe this is one of the most pressing health policy issues confronting Massachusetts today. Despite the wonderful gains we've made in expanding healthcare coverage over the past 3 years in local reform, we still have much more to do to reduce and ultimately eliminate the gaps in health status that we see by race, ethnicity, immigrant status, rural populations, and other demographic factors. There's no need for me to repeat the data, because I'm confident that you're well versed in it, and several of my colleagues today will share that with you. So I want to focus on why this is important. The issue of health disparities is complex and challenging. It will take resources and consistent attention to improve. However, we do know some strategies and solutions that make an impact, for example. As mentioned by my colleague Mary Bissinger and Barrett Charias, that there are modified nutritional programs to educate individuals and families on how to cook traditional foods in a healthy manner. The use of community health workers to help individuals and families navigate our complex healthcare system and to engage them for their routine care. But more importantly, I want to speak to you from the heart, Mr. Chairman, to the importance of these innovations from my prior position as the New England Regional Director for the Health Resources and Services Administration, U.S. Department of Health and Human Services. Similar to this grant program, HRSA funds similar innovation, and I've seen the impact these programs have on families, children, and individuals. And the truth of the matter is that the solution to address health disparities will not be found in the ivory towers of academic research institutions, nor will they be found in our government offices or agencies. They will be created and tested at the level of our communities, and it is the funding of these organizations that will get us closer to finding solutions to eliminating disparities. Far too often, I'm sure you've seen this cycle, an agency develops an effective program that begins to make an impact on the community and then is unable to obtain stable funding to continue the work. Without consistent, dedicated funding for community-based intervention, we will not see the overall change in population health and closing of disparities gap. So in closing, I'd like to leave you with a story, because I believe history is one of the best ways to learn about where we go forward in the future. Somewhere over 40 years ago, in the 1960s, we had a different kind of struggle to provide healthcare access to underserved populations. At that time, the innovative idea or the experiment was to put a healthcare delivery site in the community, and it was brought to the U.S. and piloted in 2 places, Boston and Mississippi. It was supported by Robert Wood Johnson at that time. It was after this initial innovation that started to show that this might have some impact. The federal government stepped in and started the beginning of what we now call the Community Health Center movement. In Massachusetts, there are now 52 community health centers that provide high-quality health care to more than 700,000 residents through 184 sites. And it's hard to imagine our healthcare system in the Commonwealth today without health centers. So you see, the support of innovation is critical. When you examine systems, organizations, particularly how they survive during turbulent times that we're in, one of the keys for success is to encourage widespread experimentation and innovation, and disseminating the success and the insights from that innovation. Your support of this bill will fuel experimentation and innovation, and perhaps some of the answers to address eliminating health disparities. In these fiscal times, I know it's difficult to talk about supporting this type of funding, but I encourage the committee to think about this as an investment, both for our population as well as our state economy. When we reduce disparities, we reduce healthcare costs as healthier communities need fewer and less expensive healthcare services. When we reduce these disparities, we create healthier communities that contribute more fully to all of the state's activities. Reducing disparities benefits everyone in Massachusetts. Thank you again for your time and consideration of Senate Bill 811, and I urge you to support this legislation and invest in the health of our state's residents and our communities.